The topic is HIV, or Human Immunodeficiency Virus. HIV is a virus. HIV damages the immune system so that the body is less able to fight infection and disease. If HIV is not treated, it can take years before it weakens the immune system enough to then become AIDS, or acquired immunodeficiency syndrome. Most people in the United States do not acquire AIDS due to treatment. There is no cure for HIV. Medications can control the infection and keep the disease from getting worse. Antiretroviral treatments for HIV have reduced AIDS and deaths. HIV can be prevented. Some people with HIV will get a flu-like symptom or illness within 2 to 4 weeks of infection. Some people may have no symptoms. Some symptoms may include fever, headache, muscle joint aches, rash, sore throat, painful mouth sores, swollen lymph glands, diarrhea, weight loss, cough, night sweats, other. The symptoms can be mild or significant. The infection spreads to others easier during this phase. If the person is not on treatment, symptoms may get severe, and the person may get sicker and develop AIDS. The virus continues to multiply and destroy the immune systems or the white cells, and the person is more prone to infections and cancers and diseases. Antiretroviral treatment have decreased deaths from AIDS. Those are life-saving medications. If the person is not on treatment, the person may acquire AIDS in an average of 8 to 10 years after initial infection. AIDS means that the immune system is damaged. They are more likely to get infections and diseases they wouldn't get if they had a healthy immune system. These are usually called opportunistic infections or opportunistic cancers. It can spread through sexual contact, using illicit drugs, or use of shared needles, and contact with infected blood. It can also spread from parent to child during pregnancy, childbirth, or breastfeeding. HIV destroys the white cells called CD4 or T cells. CD4 play a large role in helping the body fight disease. The fewer CD4 cells, the weaker the immune system is. AIDS is diagnosed when the CD4 cells fall below 200, or the person develops complications such as opportunistic cancer or infection. HIV can be spread by HIV-infected blood, serum, or fluids. It can happen when the person has sex, share needles, have a blood transfusion, have a pregnancy, give birth, or breastfeeding. A person can acquire it if they have sex with someone that has the infection, vaginal or anal. Oral sex carries less risk. The virus can enter the body through mouth sores or small tears that can happen in the rectum or vagina during sex. HIV does not spread through casual contact. The person cannot acquire HIV by hugging, kissing, dancing, shaking hands with someone who has the infection. HIV cannot spread by air, through air, water, or insect bites. Anyone of any age, race, or sexual orientation can acquire HIV. The person will be at greater risk if they have condomless sex. Anal sex is riskier than vaginal sex. The risk of HIV increases if the person has more than one sexual partner, if the person has a sexually transmitted infection. Sexually transmitted infections may cause open sores on the genitals, and these may allow HIV to enter the body. Injecting illicit substances by sharing needles and syringes, exposing the person to the infection. HIV weakens the immune system, so the person is more likely to get infections and cancers. Some examples include pneumocystis pneumonia, thrush, tuberculosis, cytomegalovirus, cryptococcal meningitis, toxoplasmosis, lymphoma, Kaposi sarcoma, HPV-related cancers, anal, oral, and cervical cancers. Other complications may include wasting syndrome, weight loss, neurological complications, kidney disease, liver disease. There is no vaccine to prevent HIV or to cure HIV. There are ways where people can prevent acquiring the infection. PrEP or pre-exposure prophylaxis include oral or injectable medications that the person who has no HIV infection can take or use and will help minimize or reduce the probability of acquiring the infection. Treatment as prevention or TASP, which if the person is taking their medications the correct way, they can protect their partner from acquiring HIV. That is U equals U. Having an undetectable amount of HIV virus in the bloodstream means that the person will not transmit the virus to a partner through sex. The medications need to be prescribed and taken exactly as directed, whether it is oral or injectable medications. PEP means post-exposure prophylaxis, and that is a treatment that is taken when the person has been potentially exposed to the infection. It should be taken within the first 72 hours. It may be needed for about 28 days. Use of condom every time the person has anal or vaginal sex. Discuss HIV with sexual partners. Use clean, unused needles. If the person is pregnant, the person should be on treatment. Male circumcision should be considered. It can help reduce the risk of HIV. To diagnose HIV, a blood test is needed. Also, rapid tests are available, and kits to be tested at home are available as well. The provider will be monitoring CD4 or T cells. T cells are the white cells that HIV targets. Also the viral load or HIV RNA, and the goal of treatment is to keep the viral load non-detected or as low as possible and keep the CD4s as high as possible. There are multiple different treatments available for HIV, oral and injectables. The treatment will depend on many factors like other medical conditions, CD4 cells, viral loads, allergies, resistance, other medications, among other factors. People should also be tested for hepatitis C, hepatitis B, sexually transmitted diseases, liver, kidney function, cervical and anal cancer, tuberculosis, other. There is no cure for HIV. Medications will help control and keep it suppressed and prevent complications and prevent transmission. Medications should be taken right away as soon as the diagnosis is done. It is a mix of 2 or 3 medications. Sometimes it is a single tablet regimen, but it contains 2, 3, or 4 medications. Some people may need combination treatments. These medicines attack the virus at different sites, and there are multiple classes, such as the NRTIs, protease inhibitors, integrase inhibitors, entry or fusion inhibitors. It is important to discuss with the provider what is the best treatment option for the person, the potential side effects. It is important to eat healthy, sleep, exercise, and have a positive view and mental health, and get support. I hope this topic was helpful. Thank you.